Very excited to participate in SOHO. It's always a great meeting. And in my particular session, I'll be describing the proposed optimal use in terms of timing of the bispecific T-cell engaging antibody blinatumomab. And I'm super excited because I'm participating in this debate with a good friend and colleague, Rebecca Gardner, who will be sort of arguing the opposite side of the coin with when to incorporate another CD19 targeting therapy, of course, CAR T. So for my talk, I'm really sort of focused on the data surrounding the efficacy of blinatumomab in multiple different disease settings for patients with B-lymphoblastic leukemia. I'll sort of start by giving an overview of how we've arrived at our current clinical state of use of blinatumomab, and then focus on some of the key studies that have really shaped the way we use it clinically currently, including studies looking at relapse populations of patients, as well as studies focused on its use in the MRD positive setting in patients who have achieved a morphologic complete remission. Additionally, I think there are exciting data from adult studies, but as a pediatric hematologist oncologist, I'll also be focused on some of the recent reports of blinatumomab's efficacy in the pediatric population specifically. With that background in mind, I'll then sort of lay out what we in the Children's Oncology Group are currently doing to study the incorporation of blinatumomab into the upfront setting. So in our current ALL trial, AALL1731, for patients who are newly diagnosed with B-cell ALL, we are incorporating blocks of blinatumomab for patients in intermediate and high-risk disease groups. Additionally, I'll sort of hint at a few maybe future directions for the use of blinatumomab in our patient populations, and then very briefly sort of discuss the advantages and potential disadvantages of blinatumomab compared to CAR T cells in our patient populations.